This is Module 50, in which we're going to be discussing schizophrenia. So schizophrenia is when the mind is split from reality, like split from one's own thoughts, so they appear as hallucinations or delusions. Psychosis refers to a mental split from reality and rationality and is a typical symptom of schizophrenia. So symptoms of schizophrenia include disorganized or delusional thinking, disturbed perceptions, and inappropriate emotions or actions. So symptoms of schizophrenia are usually divided into both positive and negative symptoms. So the positive ones are ones that kind of show increases in behavior or thoughts, and negative where you see decreases kind of in hygiene and things like that. So positive symptoms are hallucinations. We usually have auditory hallucinations where you hear things that other people do not hear. You can also have visual where you see things that people do not see. You can have olfactory where you smell things that people do not smell, or tactile where you kind of feel like there are things like running up and down your skin. The most common is our auditory, where people hear voices that other people cannot hear. You also have delusions, where these are kind of false beliefs. So this becomes your reality, so you believe that the FBI is out to get you. So these are called persecutory delusions. You may also believe that you are romantically involved with a celebrity. So often when we see those celebrity stalkers where they end up, in their bedroom, many of those people, have some sort of delusion that they believe that they are the boyfriend or girlfriend of that celebrity. You can also see disorganized thought and nonsensical speech, as well as bizarre or strange behavior. Amanda Bynes is a good example of this. You've probably seen in recent years some of her strange behaviors that don't necessarily make sense. The negative symptoms of schizophrenia include flat affect, so showing no emotion on the face, reduced social interactions, anhedonia, so no feelings of enjoyment, avolition, less motivation, initiatives, or focus on task, alogia, speaking less, and catatonia, moving less. So the negative symptoms of schizophrenia often look very similar to depression and can sometimes be confused, except often you'll see some of the disorganized thought processes as well and delusions in people with negative symptoms. So schizophrenia, problems in thinking and speaking. So disorganized speech, what you often will hear is called word salad or loosely associated phrases. So you can be talking to somebody who is experiencing the symptom, and while they appear to be making sense, when you really think about it, they're not. So an example would be, I was walking down the street and then the cat sat on the chicken's head and then it went up to this chimney and then down the roof I went and into this chimney and I saw Santa Claus who was walking down the street. He had his pants on his head backwards. So you can see that, there's some association but it didn't really make sense. A complete word salad is where nothing makes sense and the words are just kind of thrown together. There are also delusions, which are illusory beliefs, which are often bizarre and not just mistaken. So we often have, sometimes delusions would be things like the FBI is out to get you, I have electrodes planted in my penis, I'm having an affair with Bill Clinton, and these are all things that people have been telling me, patients that I've seen. You often see delusions of grandeur, where people are superior and have superior skills or talents or abilities. They are very, very rich, although they are, dressed in the same clothes they've been wearing for the last week, or persecution that somebody is up to get them, usually the FBI, Al-Qaeda, things like that. Also problems with selective attention, so there's difficulty filtering thoughts and choosing which thoughts to believe and which ones to say out loud. You can also have disturbed perceptions, so like hallucinations. These are perceptual experiences that are not shared by other people. So these are like when the person has, thoughts or hearing voices, seeing visions, etc. So usually the content of these voices is negative, although I've seen people who have positive voices as well, or sometimes they can switch. Sometimes it's one voice that they recognize, sometimes it's unrecognizable. Many times it's the devil. You can also, as I mentioned earlier, have visual, olfactory, tactile, or gustatory. I forgot about gustatory, so taste hallucinations as well. You'll often see inappropriate emotions, so there's odd and socially inappropriate responses, such as looking amused or bored while hearing of the death. So you can tell them something sad, and they'll be like, ha 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 ha, and just a very odd kind of behavior. For people with negative symptoms, you'll see flat affect, so there'll be no emotional content. They also have a symptom which is the impaired ability to perceive emotions in others, so they can't read faces anymore, even if they once could. There also will be odd and socially inappropriate behavior, such as errors in social perception, disorganized, unfiltered thinking, delusions and hallucinations. You'll often see people talking to themselves, gesticulating. So when people are doing this, it's often because they're in the throes of conversation with a voice in their head. You may also see people engaging in repetitive behaviors such as rocking or rubbing, or catatonia, where they're just kind of stuck in these odd positions for periods of time. Typically, the schizophrenia symptoms appear at the end of adolescence and early adulthood. Specifically for men, the 18 to 22 year period is a high risk time for them. So you'll see men often during the college years having their first psychotic break. This happens usually a little bit later for women, more like their late 20s, early 30s. About 1 in 100 people will develop schizophrenia, and slightly more men than women. And the course of schizophrenia can be acute, reactive, or chronic. So schizophrenia, the acute reactive type is in reaction to stress. Some people develop positive symptoms such as hallucinations, in which recovery is likely. However, if schizophrenia is more chronic, it develops more slowly, and you have more negative symptoms at first, such as flat affect and social withdrawal. With treatment and support, there might be periods of having a normal life but not a cure. So this is something that people have to live with for the rest of their lives. And oftentimes without treatment, schizophrenia, which is chronic, leads to poverty and social problems because people end up falling through the cracks, especially if they're not medicated. So there are different subtypes of schizophrenia. Many of these have been removed in the DSM-5, but traditionally it was defined as paranoid, disorganized, where you're seeing flat affect, incoherent speech, random behavior. Catatonic is where you kind of have that lack of movement. Undifferentiated is you have many different symptoms of the ones above. And residual is when the disease is somewhat in remission, but you still have a few of the symptoms of schizophrenia. So in order to understand schizophrenia, because as you remember from our lecture on bipolar disorder, other than bipolar disorder, it's one of the most heritable disorders. There's a biological basis. So we do find abnormal structures in the brain and brain activity. So we have too many dopamine receptors, and so that's why people with schizophrenia experience hallucinations when there's too much dopamine in there, and it's kind of similar to being high on certain drugs which release dopamine. There's also poor coordination of neural firing in the frontal lobes, which impairs judgment and self-control. And then the thalamus is firing during hallucinations as if those experiences are very real, which makes them very real to the individual. We also see a general shrinking of many of the brain areas and connections between the brain and people who have schizophrenia. So there are some biological risk factors for early development of schizophrenia. So it's more likely to develop if one of these things is present: low birth weight, maternal diabetes, or older parental age, famine, oxygen deprivation during delivery, and a maternal virus during mid-pregnancy. They did studies in Europe there were a few flu epidemics, and then they looked at birth records, and they followed those kids that were born while they were in their mother's bellies during those flu epidemics, and they found that there were higher than average numbers of people with schizophrenia during the times where there were these flu outbreaks. So schizophrenia is more likely to develop in babies born during and after flu epidemics in densely populated areas, a few months after the flu season, after mothers had the flu during the second trimester or had antibodies showing viral infection. So the lesson is to get your flu shots early, especially when you are pregnant. You can get a flu shot when you're pregnant, for those of you who may or may not be pregnant at this time. Understanding schizophrenia, so are there genetic risk factors, and if so, what we expect there to be higher levels of schizophrenia among identical twins and fraternal twins, and that's exactly what you're seeing here, that we have a higher concordance rate for identical twins as opposed to fraternal twins, because identical twins share more of their DNA. So this suggests that there are genetic factors involved. So if one twin has schizophrenia, the chance that the other one has it will also be greater if they're identical. Having adopted siblings or parents with schizophrenia does not increase the likelihood of developing schizophrenia, so it's not something that can be learned. So even in identical twins, there's not 100% concordance, which means that there are other factors that contribute to schizophrenia, which could be attributed to environmental differences. So we see the first difference is twins in separate placentas. Only one of the two twins has enlarged ventricles, which is something we see in schizophrenia. We also see this in dementia as well. So even if maternal flu during the second trimester doubles the risk of schizophrenia, this means that only 2% of the babies develop this disorder. Genetics may differentiate these 2%, and research shows that many genes linked to schizophrenia are linked to schizophrenia, but it might take environmental factors to turn these genes on. Are there any schizological, if this is my Freudian slip, are there any psychological causes of schizophrenia? You'll see at the bottom that's a picture that is drawn by somebody who has schizophrenia. I have a similarly beautiful picture which was drawn for me by a patient, and you'll see oftentimes very prominent eyes, because oftentimes that's something that they see when they're kind of in their delusion or hallucinatory state. So research does not support the idea that social or psychological factors such as parenting alone can cause schizophrenia. However, there might be some factors like stress that it can affect the onset of schizophrenia. And so what we do right now is we just look at factors that can increase the risk. What we do know is that people who already have been diagnosed with schizophrenia do better if they are not returned to very stressful environments, because that can exacerbate the relapse of schizophrenia. So things that we know that tend to appear before the onset of schizophrenia are early separation from parents, people with short attention spans, disruptive or withdrawn behavior, emotional unpredictability, and poor peer relationships or solitary play. And I don't know if these are necessarily risk factors or these are just prodromal symptoms, meaning they're the early symptoms that we see in individuals with schizophrenia. So these are the biologic factors which tend to appear: having a mother with severe and chronic schizophrenia, birth complications, and poor muscle coordination.